I want to talk about the lessons that can be drawn from Rwanda's experience with the Assurance Mutuelle de Santé. So first, why is this a success? It's a success because it has been shown that this health insurance system has reduced occurrence of catastrophic expenditure, the one that forces households to liquidate assets or livestock, by 20% and has reduced the depth of the poverty experienced by 50%. How have they achieved this? They have achieved this by having over 90% coverage, where the poor are covered not by contributory money from themselves, but by other mechanisms, which I'll talk about in a minute. They've achieved this by a prioritized and comprehensive benefits package, which includes maternal and child health, which includes the big three, but also includes access to non-communicable diseases. We just heard about diabetes, for instance, and the impact that can have. But they've also balanced out these costs with mechanisms to avoid moral hazards and revenue raising through systems like taxes on fuel, taxes on medicine registration, taxes on telecommunications, which come to fund a system that can then deliver essential medicines, healthcare workers. So what lessons can we draw? For me, there's maybe 5. The first one is that we need to balance the triad between the purchaser, the policymaker, and the provider. We need to, within this context, define a private sector role, which is contractual and which is performance-based. We need to have digital accountability, and this concretely means integrating the claim system and the DHIS2 system. We need to have equity and solidarity, and this system builds on traditional models of community solidarity, but it becomes the real manifestation of this fabric of the nation. And then the last is that we need political stewardship, where it needs to be positioned at the presidential level, at the prime ministerial level, for the reform to succeed.